So I'm got this. All right. Welcome everybody. I am here with Dr. Pete Tanavica. We just DC, we actually call him Dr. Pete. And so I've got a few questions for you, Doc. Uh, let's kick it off with let me ask you, what conditions can chiropractic care actually help with?
Well, typically, most of the people that come in, they come in with low back pain. Uh, Probably the next thing, they come in with neck pain and headaches. A lot of people come in after that with mid back pain, muscle spasms, strains, especially, after a car accident, there's whiplash, low back sprain, strains. And then, a lot of people come in with sciatica, and based on if it's something regarding sacroiliitis or if it's a herniated disc, that determines if we're able to treat them or not. Usually, if it's just a sacroiliac joint problem, we're able to treat them pretty good. But if it's a bad disc, that's usually when I say, if it feels this much better the next day, then we can probably, treat you and get you well. If it doesn't change at all, then it's probably something that requires either a cortisone shot or possibly surgery. Uh, However, you know, that's typically, what chiropractors see and typically what insurances cover and everything else. What I want people to understand is chiropractic is about nerve flow. It's about finding the areas of the spine, the 24 movable vertebrae that get stuck together, puts pressure on the nerves, and it dampens down the nerve flow. It cuts down the nerve flow. So the very first chiropractic patient ever in 1899, 1895, his name was Harvey Lillard. And he was deaf. He was deaf for over 20 years. He was a janitor, and 20 years prior, to his, being cured, he was taking something off a shelf, a big object, and it hit him in the neck. And he had lost his hearing from that. And he had tried, everything that medical technology had to offer at the time, and nothing worked until he went and saw Dr. D.D. Palmer, who invented chiropractic. And within 3 treatments, he found, vertebrae that was stuck together. It was out of alignment in his neck, and he adjusted it back in, and voila, his hearing restored. So chiropractic is about nerve flow. I even have a patient where, you know, he had watched the video and I knew about this. It's called the arc of life. It's C3, C4, C5 keeps you alive. Those are the vertebrae in your cervical spine that the nerve roots that go to your lungs and your heart innervate. So by doing these adjustments, I got him off of all of his respiratory medicine, and his pulmonologist says by all objective measures, he's getting younger just from keeping these adjustments and the nerve power flowing. So it's all about keeping the life power. You look at the hierarchy of what is involved. Uh, in regulating the body. It all comes from the brain and spinal cord, the central nervous system. Everything else is secondary to it. So it's the chiropractor's job to keep those nerve holes where these nerve roots come out from the movable segments in the spine, keeping that free of restriction so we have uninhibited nerve flow.
All right. Well, on that subject, are they chiropractic adjustments safe? Do they hurt?
Well, they're very safe. And, sometimes when somebody's been restricted for a long, long time, the initial adjustment may hurt because it's so stuck together. And then
Mhm.
usually within a minute or two after that, the patient feels a lot better. Um, as far as safe, some of the things that happen, sometimes after an adjustment, I usually tell everybody after their first adjustment, you're probably going to be sore, kind of like going to the gym for the first time after, in the next day, because, putting these vertebrae, back into place and taking the restrictions out of them, it causes the muscles to relax, muscles to go into, kind of like a little spasm, because it's called muscle memory. The muscles just kind of pull the vertebrae back into place where they shouldn't be sticking together. So it's, typically you get some muscle soreness. Um, the possibility of a intercostal strain, a sprain strain happens once in a while. Very rare, but once in a while, a broken rib, very, very rare, like maybe once every 10 years or so. And then, there's been a lot of controversy on, the possibility of strokes happening. I've been in practice 24 years. I haven't seen it. It's probably the way I adjust. I adjust very, very carefully. I use, the adjustments that I do are, it's not causing any strain on the vertebral basilar artery, which is what would cause a stroke.
Hmm. Oh, all right. That was informative. So let me ask you, how many sessions will typically need, or how long does treatment take? How does that work?
It varies. It varies per individual. Usually at the very low end is about 8 visits to all the way over, 100 visits, and then even more after that for maintenance type, you know, uh, type plans that we have to offer. It's usually, if somebody comes in with just some mild back pain or something like that, you know, 8 to 12 visits. Somebody comes in a very bad, car crash. I've treated people well over 100 visits and then, into maintenance mode after that. Um, a typical chiropractic patient is usually around 20 to 24 visits. And that's just, based on the most of the people come in and relatively, you know, uh, moderate to severe pain. They've had back issues or neck issues for a good, 2 to 3 months, and then we have to basically do 2 to 3 months worth of care to reverse the problem. So that's basically our standard care plan.
Okay. Um, let me ask you, what techniques and methods do you typically use to treat patients?
My favorite technique and what I use on probably 85 to 90% of the patients that come in, it's diversified. Um, it's basically I go and I physically feel the spine with my hands, and then I do a manual adjustment with my hands. I also use a drop pieces in my adjustment table, just
Mhm.
to kind of push the spine forward, usually around the pelvic area. And then for elderly patients and for patients that don't want certain areas manually adjusted, I use the activator instrument. It's just a little instrument that has a high velocity, low amplitude, like little push that it sends into the spine to kind of stimulate the nerve pathways, and just give a little joint play to the motion segment that's stuck.
All right. Well, let me segue a little bit here. Um, how do you create personalized treatment plans for each patient?
Based on the patient's complaint and how long the problem has been there, the severity, if it's an injury like a bad whiplash or some injury from a work related issue. It's based on the overall health of the patient, you know, how old the patient is, how many, you know, accidents and injuries that they've sustained over their lifetime. If if it's an acute injury or if it's something that has been a chronic issue for a long time, we have to take a lot of different things into account to develop a treatment plan.
Okay. And what can I do at home to support my treatment and prevent future problems?
Well, the best thing that you can do, and there's a few of them, at home treatments, we typically try to help people with their diet. If you eliminate hydrogenated fatty acids and seed oils out of your diet, along with simple exercises like cervical retraction exercises to restore the lordotic curve in the cervical spine, and pelvic tilts and stuff like that that help reduce the amount of tension in the low back and also help with that lordotic curve in the lumbar spine. Uh, you know, also doing ice and heat. You know, if you have some pain issues, that ice will help soothe. Like if you're having an acute type of pain, like a sprain, strain, or a sore muscle, and if it's something chronic, using moist heat.
All right. And with that in mind, how much does treatment typically cost? And do you accept insurance?
We accept all the major insurances. We accept Blue Cross Blue Shield. We accept Harvard Pilgrim, Cigna, Fallon, WellPoint, Mass General Brigham. We do a lot of workers' compensation. Like if you get hurt at work, the work
Mhm.
insurance should pay for it. And we do a lot with personal injury protection from car crashes. If you were getting any kind of
I see.
car crash, the policy on your insurance in Massachusetts covers up to $8,000 worth of treatment. And, you know, a
Yeah.
lot of that, basically everything is covered, all your supportive procedures, modalities, the adjustments. People who pay out of pocket, we, for a very basic visit, it's around $50. And then we have different plans that you can buy at a discounted rate. We block the visits so you can buy the visits, out of pocket at a discounted rate. Or if you, let's say you have Blue Cross Blue Shield and you have a $20 copay, what we do is if you need 20 visits, we will typically block, you know, the 20 visits, but if you pay up front 13 co-pays, which is $260, you get, another, 7 visits for free.
Oh,
So
nice.
you save money, paying up front with co-pays. And, that's how you know, we go and design, the treatment plans like that so people can save money. We try to help save people, as much money as we can.
Nice. Nice. I'm sure we all appreciate that. And in your opinion, is chiropractic care safe for children and elderly patients?
Well, based on my experience, I have to say again, it's very safe. I've adjusted babies as young as 10 days old and people well into their 90s. And,
Mhm.
it's very safe. Like I said, it's all about finding where the subluxation is, doing, as light of an adjustment, especially, with elderly people who just want to just move that vertebrae a little bit. Same thing with a baby. Most of the times the mother is holding the baby while I'm doing the adjustment. So, it's very, very safe and very easy.
Awesome. Awesome. So, Pete, how do you stay current with the latest chiropractic research and techniques?
Well, we get all these publications mailed to the office that go over different things that different chiropractors are doing and all these other, different, you know, treatment modalities like spinal decompression and all these other things with lasers and everything else. But that's what we do, on a consistent basis. I'm also, a member of uh, David Singer Enterprise, where you know I constantly, talk with a consultant on a weekly basis to get new and improved stuff that's out there. And on a yearly basis, we have to do 12 credits worth of, chiropractic education to keep us, up to date with
Mm.
everything that's going on.
Oh, okay. All right, great. And how do you work with other healthcare professionals?
Well, we get a lot of referrals from, medical doctors with massage therapists, physical therapists, different types of healthcare professionals. And of course, we always, refer out when necessary. Like if somebody comes in, they have an acute herniated disc or something like that, I always, try to send them back to their primary care because if my treatment isn't immediately effective for them, I try to say, look, you need to get on some anti-inflammatory, some Metarol or something like that, and I'll ask them to, go back to their primary care doctor, or I'll send them off to a, urgent care, provider that they
Mhm.
can prescribe them something. And of course, if somebody has a bad herniated disc, I just say, look, at you need to see a specialist to either get a, cortisone injection or possibly surgery. Same thing with other, joints in the body. Like if somebody has a bad tear in their shoulder, I'll refer them to usually Dr. Decio. He's a orthopedic surgeon who specializes in that. We also get a lot of referrals from lawyers, from car crashes, and of course we refer out to. Um, yeah, we refer back and forth with a lot of different healthcare providers. So
Excellent, excellent. All right. Well, I appreciate your time today. Is there anything that you want to say to any potential patients out there?
Um, well, basically, we're here to treat patients. We're here to, people are in pain. You know, that's ideally what we do. That's what draws people through the doors. Like I said, once, probably a couple times a year, we'll get people who just, you know, ask around because they've already been maintenance patients before, and they ask if we just do, the typical blocks of visits that we offer. Of we accept their
Mhm.
insurance to just do maintenance visits, which I think is wonderful. We do convert a lot of people into that, that maintenance mode, because it's very important keeping your nervous system working well. If you look at it, your nervous system is essentially the same thing as your immune system. There was a study done back in the 1980s by a Dr. Ron uh, Perot, not Ross Perot, but he was a PhD. Uh, he was a PhD cancer researcher, and he did this decade-long study where he compared, you know, chiropractic patients who were on maintenance, where they would get adjusted on a regular basis, once every, 2 to 3 weeks, sometimes once a week. And he found that their immune systems functioned 200% better than people who didn't, and 400% better than people who had chronic issues like cancer and chronic pain problems.
Wow.
So there's a
Wow.
lot more to chiropractic than just fixing, necks, neck pain, neck cricks and back aches and stuff like that. It's about keeping the nerve power flowing. You're keeping the nerve power flowing to all of your, vital organs, your heart, your lungs, your liver, your digestive tract, basically everything. You're keeping all that life power flowing.
Wow. Well, it sounds like that old saying, you got the snap, crackle, pop down, and it's very beneficial. One point that I don't think we touched on is that you have an open door policy. Stop in anytime when you're open. Is that true?
Yeah. Yes, absolutely. In fact, that's what we do with all our patients. We give them the office hours so they don't have to make any formal appointments if they don't want to. Some people do because they just need to be regimented like that. But we
Okay.
just hand everybody the office hours and just say, look at when we're open and show up at your convenience.
That's awesome.
Because
Awesome. All right. Pete,
yeah,
thanks for your time.
yep.
You have an
And just,
amazing.
yep, just,
What?
the typical time it takes for an appointment in here. We put people on the roller table for a couple minutes, and then I do the adjustment. It's only about a 5 minute visit. I don't take that long unless you need other therapies or if you need an exam. If it's car crash or something like that, where you need electric stim and heat and all this other stuff, it usually goes around 15 minutes or so. Most people are in and out of here in 5 minutes. So it's a very quick visit.
Wow, that's a great point. Great point. All right, Pete. Thank you again for your time. You have an amazing
Yes,
day.
sir. Thank you, Jack.